Hi there, my name is Dr. Katrina Cox. I'm a naturopathic doctor and the author of The Opportunity in Cancer. So one of the reasons why I really love that Mental Health Awareness Month is in January is because it's a very special month in the sense that where we live in North America, especially, it is one of the coldest months. It is also the month with the shortest amount of day, like hours in a day where we see sunlight. And so because of that, those factors can contribute to some of the lulls that we can experience. They can make our anxiety and depression a little bit worse. There's also a secondary factor. A lot of times, and this is a global factor, a lot of holiday celebrations happen in December for all kinds of different faiths and religions. And one of the things that can happen in January is that we're a little bit flat because of that. We've maybe added extra things to our plate in the month of December just to be able to celebrate with the people that we love or connect with the people that we love. And because of that, we've expended extra energy, extra finances, extra time. And so January can be a flat month in the terms of there's like recovery from that. And so there's a little bit of extra burnout, holiday burnout, if you will, that we're looking at recovery. Sometimes people will push through this and they get really motivated and fired up. They're going to make changes. It's the new year. The challenge becomes that a lot of times we're dealing with a very low pot of energy. Because of the time of year, we really are in hibernation mode, especially in North America, because we're so far away from the sun. And so trying to overcome that by those extra pieces of energy is really not working in congruency with what we're at in terms of the environment and the things that we're doing. And it doesn't mean that we should not do physical activity. It just means that sometimes when we go gung-ho, we're adding to the problem instead of being able to subtract from the problem and feel good about ourselves. And so there are a lot of things that make it really important that Mental Health Awareness Month is in January. And those things can be compounded for cancer survivors such as yourselves, because sometimes we don't even recognize the fact that we're in depression and we're having extra anxiety, and realizing that those are very important factors to understanding. A lot of patients such as yourselves will not hit the markers normally for depression and anxiety. And so sometimes treatment isn't given as an option. So what I'd like to ask you today is sit with yourself, understand a little bit about how you feel, create space for yourself. If you need a little bit more time alone, or if you need a little bit more time with people, find ways to create that for yourself, because ultimately we don't have to do this in isolation. There is help somewhere. Join our community at the Cancer Remission Mission on Facebook and Instagram. We'd love to see you so we can talk and touch base.